Hello, and thank you for tuning in to our Facebook Live Q&A about COVID-19. I'm joined once again by UI Hospitals and Clinics Hospital Epidemiologist, Dr. Jorge Salinas, who will give us an update on the state of the pandemic and answer questions about precautions, the holidays, and more. Please submit any questions or concerns you have now, and we'll answer as many of them as we can throughout our broadcast. Thanks for joining us again today, Dr. Salinas.
Very glad to be here.
One note before we begin, this video is for informational purposes only. So if you feel sick or are concerned about your health, we encourage you to contact your primary care provider or schedule a visit to speak to a provider. Dr. Salinas, let's start with an overview of the pandemic here in Eastern Iowa and across the state. What is the data telling us right now?
So the Midwest continues being at the epicenter of COVID in America. The number of cases per 100,000 population remains at critical levels, but fortunately, in many states throughout the Midwest, that incidence seems to be going down. It's still a bit unclear what the effects of the past holiday will have on incidence. It may stop the decrease in number of cases. It may lead to an increase in cases. The next 1 to 2 weeks will tell. What's clear is that other states that had a lower incidence will have a growing incidence as a result of this holiday. So it's very clear if somebody travels from a state of high incidence to a state of low incidence, some cases will go in following that gradient. In the case of the Midwest, because our incidence was that high, the holidays may not lead necessarily to a very high second spike. That's my hope, but that's completely contingent on the public health measure implementation that Iowans took during the past holiday.
Thanks for that update. And my next question is, how have these trends impacted what's happening inside our hospital recently?
So over the last month, in November, we had the most cases diagnosed, the most hospitalizations, the most patients in ICU, and the most deaths compared to other months in the pandemic. The good news is that our number of hospitalizations has decreased slightly over the last week. We will, again, have to continue monitoring the trends over the next couple of weeks to determine whether this trend will continue, remain stable, or worsen again.
Yeah, and so you already touched on the fact that we don't know yet how Thanksgiving or how gatherings throughout the holiday are going to impact numbers. But if you had to guess, what would you expect going forward over the next month from cases in Iowa?
My prediction is that the number of cases will remain relatively high in Iowa over the next month. I am hopeful that they won't reach the same levels as early November. But again, that's dependent on what Iowans do. But lately I am more optimistic. Just today, the Advisory Committee on Immunization Practices, ACIP of CDC, of the Centers for Disease Control and Prevention, is actively discussing who should get the first doses of the COVID-19 vaccine, a vaccine that is 95% effective in preventing infection. It also appears to decrease the severity of illness. So there is truly light at the end of the tunnel, and we just need to hunker down a little bit longer and prevent as many hospitalizations and deaths as possible. So I think that gives us all hope that the pandemic end is in sight.
That is a silver lining of 2020, is that researchers from all around the world have come together to find this several vaccines that we can hopefully count on. And yeah, that is a bright spot. So thank you for reminding us of that.
So Let me add just one other, silver lining. Yeah,
Yeah.
is that there are new therapeutics, new medicines that can be given that have received an emergency use authorization from the Food and Drug Administration, the FDA, that can be given through an IV, and as soon as you're diagnosed, and they may prevent you from needing to be hospitalized. In other words, it may decrease the severity of your COVID-19 illness. Currently, UIHC is administering these monoclonal antibodies, the same type of medications that President Trump received when he was ill. Um those are being administered here at the University of Iowa to patients that meet certain indications, patients that are more likely to develop severe disease. So, bottom line, we know more about COVID. We know how to prevent it. We have more treatment options, and we will very soon be administering vaccines to people.
That is good news. And you touched on something really important that we hammer every time we talk, is that we do know how to prevent the spread. So we need to keep our distance from others and avoid enclosed spaces, wear masks when we're in public, practice good hand hygiene as always. Are there any other things you'd like to remind our viewers of how we can all reduce the risk?
Well, I think that number one, especially during the winter, during our holidays, and because the incidence is so high, is that we need to limit the number of people that we gather with. Ideally, you would only gather with the people that you live with. But if you must gather with others, try to limit the number of people involved in that gathering. If it's maybe another family that is following the same precautions that you are, that may be okay. If you're able to maintain some distance, if you wear face coverings, it may be okay. But be very careful about large classic Thanksgiving type of gatherings of 20, 30, 50 people. Those remain risky in Iowa at the moment.
Yeah, and you actually touch on, someone asked over the weekend on one of our social media posts, why is the general guideline 10? We've been using that general guideline of try to keep gatherings 10 or less. Can you just help us understand? We know that if the fewer people that attend, you're lowering your risk, but is there a reason that we kind of stick with no more than 10 people at a gathering?
Yes, well, it has to do with decreasing your risk to less than 50%. That's still a high risk, and it depends on your tolerance. I currently have the COVID-19 risk assessment planning tool from Georgia Tech. And for example, for Johnson County, a gathering of 10 people leads to a risk of 37%. But if you move that to, let's say, 20 people, the risk would go up to 47%. So again, you want to bring that number down as low as possible while still trying to be able to socialize. So I think that this is, good news, that you can gather with 10 people and your risk is still 1 in 3. It's not that great. But if you limit the duration of the gathering, if everybody has a face covering, if the space is not a crowded space, but people are distanced and there is good ventilation, it may be acceptable. The chances that people will walk out of that gathering without acquiring COVID may be acceptable, may be good.
Well, thank you for that information. I do want to get a little personal and talk about, how did you handle Thanksgiving with family? I mean, it's a hard thing when you don't have a lot of family nearby, or when this is maybe one of the only times a year you see a lot of your family. So, do you feel comfortable sharing with us how you handled the holiday?
Yes, absolutely. So I have most of my family live very far from here, and I had a family member that quarantined and traveled and visited, one person, and we wore masks, and also this person was going to travel internationally soon, so was tested as well. So at any rate, again, if you limit your gatherings to a very small group of people that are following the similar public health recommendations that you are, it may be acceptable. Again, if we said that The risk in Johnson County is 47 for 20 people, 37 for 10. But if you go to 5, 3, 2, 1, maybe the risk goes down to 5% or so, and then it may be more a tolerable risk.
Yeah.
How did you do?
Yeah, I mean, I had to limit my family gatherings at Thanksgiving. Both my husband and I have larger families when you get all of the nieces and nephews and the grandkids in together. And so I limited mine, and the conversation was a little uncomfortable at first, sharing that we wouldn't be gathering in person, but we ended up not being the only people who decided not to do that. And so that made it easier as more and more people said, yeah, maybe we shouldn't do that this year. Next year we'll have we'll do it really big next year for Thanksgiving. And so I just want to encourage people that if you do have to have that conversation because family members aren't taking the same precautions, or you just have a really large family and it's just not safe, it can feel uncomfortable, can be a little nerve-wracking to approach the conversation, but I think a lot of people have the same concerns right now. Is we want people to be safe and we want to get through the holidays knowing that next year will be normal. So for some people like me, that may mean not seeing family for this holiday, except for on Zoom. We did Zoom gatherings.
I think so. I think that hopefully and very likely 4th of July will be nice. Next Halloween will be nice. Thanksgiving next year will probably be back to normal if we get all these vaccines, therapeutics, etc. So yes, there is light at the end of the tunnel. Just continue doing the right things for a bit longer.
You just saying that hopefully all those holidays next year will be normal just made me so happy.
Can you imagine, right? Like the 4th of July outside with all your family, and
Yeah.
you may not need to worry about COVID at that time.
Yeah, that's wonderful. That's just something wonderful to look forward to. And speaking of the vaccines, there's 2 COVID-19 vaccine candidates from Pfizer and Moderna that have officially filed for emergency use authorization with the FDA. So what's the latest on these 2 vaccines? And you already touched on it a little bit, but do we know who might be the first to receive these vaccines?
It's very likely that the first people that will receive it will be frontline healthcare workers. It may include people at very high risk, people that work or live in a nursing home, for example. And from there is going to go to other members of the community that may have a high risk, perhaps people that live in congregate settings, as I mentioned, and then it's going to go to the elderly, people with chronic medical conditions, and eventually everybody else. But that's my speculation. The ACIP is gathering today. I'm hopeful that by the end of the day, they will have a resolution of who will get it first. But because both vaccines are seeking emergency use authorization from the FDA at about the same time, it's possible that we will have enough vaccines by the end of the year to cover some of the highest risk people.
And both vaccines are pretty close together in terms of effectiveness, right? They're both around 95% effective.
It's very interesting. Yes, both use a technology called messenger RNA. And yes, they are, even though they were developed by 2 different companies and the trials are completely different, they're showing very similar results. 95% effectiveness at preventing infection. And we have data for the Moderna vaccine that there were 30 severe cases of COVID, but the 30 cases occurred in the placebo arm and 0 occurred in the vaccine arm.
Wow.
So it appears not only to prevent infections, but if you get infected, the disease will be milder. So you may not need to go to the hospital or potentially even die. So that's great. These vaccines appear to be highly, highly effective, at least very early on. We'll have to see as time goes by for how long the immunity lasts. But after both trials included nearly 100,000 people. So that larger trial is designed to assess how good the vaccine is at preventing infection, but also to look at the safety of it. And it appears to be both safe and efficacious. So right now, members of academic medical institutions, public health authorities, CDC, and members of the public are part of ACIP and are assessing who is going to get the first doses of this effective and safe vaccine.
That's incredible. And I knew that the Pfizer vaccine, which was the one the University of Iowa has participated in, I knew that that had around 30,000 participants. But to hear that these have been tested in total on around 100,000 people, I hope that gives people who are a little nervous about getting this vaccine, I hope that makes them feel a little better. I just heard someone yesterday say, I don't want to be one of the guinea pigs. I'm not getting it for the first year it's out. And my thought was, oh no, we've already tested it on enough people. So hearing 100,000 people have already gone through this and we found that they are indeed safe. That makes me feel really excited about these vaccines.
Yes, absolutely. It is true that from these trials, it appears that the vaccine has some reactions. Your arm can remain sore. You may have a little fever, which happens with many vaccines. It's a reaction of sorts. And that's what you want. You want a vaccine that is stimulating your immune system, is training your immune system. Imagine that you're taking your immune system to the gym, and if it doesn't hurt, it doesn't count. You have to train your immune system a little bit. So this vaccine will have some reaction, again, some soreness at the injection site. But I think that's a price that I am completely willing to pay. Not only because I will not get sick, it will give me the certainty that probably I won't need to be hospitalized or die. And also, more importantly, it may prevent me from giving the disease to others. So we talk about this, or people talk about these strategies of the way to avoid the consequences of COVID is protecting the elderly, keep them secure, and everybody else go about their business. It doesn't work. There is no effective way of protecting the elderly but by decreasing the incidence of COVID in everybody in the community. So the vaccine is going to achieve that with a 95% efficacy. So if all Americans receive the vaccine, we're going to make COVID go away.
Oh man, sweetest words I've heard in 2020.
Yes.
Well, we're gonna do a quick reset to welcome anyone who's joined us since we started the broadcast. If you're just tuning in, we're here with Dr. Jorge Salinas, hospital epidemiologist at UI Hospitals and Clinics, and he's answering all sorts of questions that we have and that you have about COVID-19. So feel free to submit any questions you have, and we'll try to get to as many as we can. We are receiving a lot of questions on Facebook, so I want to make sure we get to as many of those as we can. So Rachel asks, can we get together with families as soon as we get the vaccine, or do we have to wait for herd immunity? Or do we know that yet?
So I think it's going to be useful for everybody to continue wearing masks for the time being. But if everybody in your family and everybody in your household and the members of the other household have received the vaccines, especially this vaccine comes in 2 doses. Probably after receiving those two doses, if you wait a week, that's when the efficacy was assessed. So yes, you would say after a week of the second dose, your the immunity that the vaccine provides to you is 95%.
Wow, that's incredible. Joni asks, will the COVID vaccine benefit people with autoimmune diseases considering the immune system attacks itself? So I'm not, do you understand that question? I'm not a doctor.
Yes, so the immune system of any species, including humans, is exceedingly complicated. And people that have autoimmune illnesses, their immune system is acting up a little bit. It gets a bit confused and it reacts against yourself. So it's a bit unclear how the vaccine will work in those type of patients. But my hunch is that it will work well for them as well. I would ACIP, the CDC, the FDA will provide the clear recommendations of who should get it, but my hunch is that they will likely recommend it for people that have autoimmune illnesses as well.
Great. Um, you mentioned earlier that we know so much more about the virus now, and Gail asks, do we know yet how long you stay positive after having the virus and how long you are contagious?
Absolutely, this happens very often. The the test that we use to diagnose COVID-19 is a PCR test. We do a nasopharyngeal swab and we look for RNA, viral RNA. Interestingly, RNA is just microscopic, and it can persist in your airway for months. It doesn't mean that you're detecting the entire virus, you're just detecting pieces of the virus. So people with COVID are infectious 2 days before you even have any symptoms. And that's why we wear masks, because we don't know if we are going to have symptoms 2 days from now. 2 days before symptoms and 2 days after the onset of symptoms. We tend to isolate people with COVID for 10 days from the onset of symptoms. So after 10 days, if you didn't need to go to the hospital, you're safe to go back to work as long as you feel better. You don't have fever, your breathing is okay. However, your test may remain positive for months. It doesn't mean that you're infectious. It just you're infectious only for those 10 days of isolation.
Great. Luann asks or says her daughter had a serious case of COVID-19 and is pregnant. She's wondering, will this affect the baby at all? And do we know much about that?
Uh, I think now we do know several things about COVID in pregnancy. COVID, like many other infections, can worsen the outcomes of the pregnancy, can lead um, to labor, sometimes before it's due. So that's one potential problem related to it. Pregnant women, however, if in many women that are able to deliver at term, their babies are normal. They don't get COVID. The babies don't get COVID. What may happen is that it may induce labor sooner than it should. Than it should. But something else that we've learned is that pregnant women, even after they've recovered from COVID, they continue having what's called long-term COVID, or they become long haulers. They continue having symptoms or sequela of COVID for longer than non-pregnant people.
Okay. Thank you for providing that information. Um, Kay asks, once you've had COVID-19, how long is immunity likely to last?
So immunity, again, as I mentioned earlier, is very complicated. But for most people, it is believed that immunity will last at least 6 months, probably longer. And that's the immunity provided from a vaccine, from an infection. Vaccines may provide immunity for longer. We will have to see, uh, after we vaccinate people and we monitor them for a while, but at least 6 months.
Great. Um, Joellen asks about silent carriers. Can you explain to our audience what silent carriers are, and is there a test to determine if someone is a silent carrier?
Yes, so COVID is a very sneaky disease because in some people it causes no symptoms, or the symptoms are so mild that you don't pay attention to them. They are people that have very mild or no symptoms are called asymptomatic, without symptoms, asymptomatic. Then, so yes, that's a possibility. People may have COVID and not know it. That's why we recommend masks, because you may be spreading COVID without knowing it. There is a way to test it. Yes, if you do the PCR test, the nasopharyngeal swab for COVID, Yes, it can detect people that have that are asymptomatic.
Great. Um, so I think this is a question that a lot of parents of college students specifically are going to be having over the next month. Is Janice is a parent to two college students, and she specifically is in a high risk category for COVID-19. So she's a little worried about her kids coming home for the holiday break, and she's planning on having them quarantine for 14 days. But she's wondering, is that enough, and should she be worried about asymptomatic spread if her kids quarantine for 14 days, but they still somehow have it? So can you break down, is that the best thing parents should do, is try to have a quarantine period?
I think that would be ideal. If people quarantine before the trip or after the trip, that reduces all possibility of bringing COVID into the house. Again, the good things that you need to look into are what's the incidence of COVID in the place where they're coming from. If the incidence of COVID is low there, that decreases the risk that they will bring COVID to your house. The number of people, if it's one or two, that may be more acceptable. And also their practices, their behaviors. If these people are out and about and partying in their college town, then that's problematic. You want them to quarantine. You want them to not go to the bars for the 2 weeks before their trip. But if they follow all the public health recommendations, they wear masks consistently around others. Uh, I think that the risk of them bringing COVID home is it may be acceptable. But every family will have to make a decision. The families that want a zero risk may want to avoid inviting their family for these holidays. But if you have decided that you're gonna invite people over for the holidays, reduce the number of people to maybe one or two at most, and start implementing these public health recommendations, universal mask wearing, um, uh, 2 weeks before the trip.
Yeah, and for students going back to campus, for those who will be, who have in-person classes in the spring, do you recommend that they try to isolate as much as possible before they go back to school as well, just in case they were exposed on their break at home?
I think that would be reasonable, and each school will provide specific guidance. But especially if you come from an area that has a very high incidence, like Iowa, for example, at the moment, it wouldn't be unreasonable to do so.
Great. Thanks for that guidance. I'm sure Janice and some other parents are going to feel a little bit better having some expert advice on that. Mona asks, how do you share a house with one bathroom with someone that has the virus?
Yeah, that becomes trickier. Ideally, you would want to have your own bathroom. What you can do is uh, give it some time in between people using the bathroom. You can clean afterwards. But it's very clear nowadays that the main route of transmission of COVID is through the air, and being in close proximity to somebody, and less so in surfaces. So I would let so I think it's good advice anyways. Just sometime in between people using the bathroom, and then you may want to wipe with any kind of disinfectant, whatever product you use to clean your bathroom regularly. You can use it in between uses of this individual.
Those are some good tips. And then just, of course, making sure there's good hand hygiene from whoever lives in the house, making sure you're washing those hands really well. And I mean, I'm sure it doesn't hurt to put hand sanitizer outside the bathroom too, if you really want to get careful.
Absolutely.
So Ben asks, is it inevitable that everyone will get COVID-19?
It's not inevitable. It's evitable. Yes, we can avoid it. If we all wear masks, maintain physical distancing, avoid crowds, we can bring the incidence down. There's a vaccine around the corner. Yes, I don't think that 100% of humankind will get COVID-19. Hopefully, 100% of humankind will get a COVID vaccine that will give us immunity against this disease.
Yeah, I hope so too. So this is actually a question for me. So I've heard people say something like, well, I was in a crowd or I was with these people, but I stayed 6 feet back, or yeah, I was talking to them, but I was wearing a mask. So how safe is it for people if they're only taking, one precaution? Maybe they're wearing a mask, but they're in close proximity, or they're 6 feet apart, but they're in an enclosed space. Is that still reducing the risk, or should we be doing more?
No, I agree. I think that we have to apply more than one guidance. Some of the guidance that we've put together in our social media put as number one in the Swiss cheese model. Number one is avoiding large crowds. And that's the first one you want to do. There is this misconception that if you go to a bar or to a restaurant, and as long as you keep 6 feet of distance in between two tables, you're good. It doesn't work. It's been proven. There are very well studied outbreaks in restaurants and bars where people were farther than 6 feet of distance. What you need in an enclosed space is adequate ventilation. We all produce small particles or aerosols as we breathe, cough, talk, etc. If we have a bunch of people breathing and talking, our aerosols get combined and we're breathing each other's aerosols. So at that point, distance doesn't matter. You're gonna get exposed anyways. So be very careful. Don't go to a crowded place, even if you can keep 6 feet of distance.
Great. Thank you for that reminder. And speaking of reminders, in addition to living through a pandemic, we're also in flu season now. So what's the status of influenza cases in Iowa, or how we're doing so far in flu season? And do you have any reminders you'd like to give people?
I think Iowa is doing great from the flu perspective. There are very few cases in Iowa, virtually none. I think it has to do with the fact that almost everybody around the globe is following COVID precautions. So flu is having a hard time traveling from tropical areas to colder areas, but it's still early in our winter season, in our cold season. So flu can make its way into Iowa, and the good thing is that all of the recommendations we've given to avoid acquiring COVID work against the flu. So if we do a good job in controlling COVID, we are going to have a mild flu season.
Yeah, and if you've ever had the actual influenza, you don't want it. So let's keep doing what we've been doing and keep people from catching that virus as well. Believe it or not, we're out of town. We're out of time. So I just wanted to give you a chance, Dr. Salinas, to leave our audience with any final thoughts you have for them today.
Let's continue pushing, guys. We're doing a terrific effort for now 8-9 months, and it's a bit sad that a bunch of people have gotten sick and are in the hospital, etc. But we are turning the corner. We're having fewer cases. Let's continue doing the right thing. Avoid large crowds. Wear your mask. And once a vaccine becomes available, if you're eligible for it, please go get it. Also know that there are now newer treatments against COVID. So if these monoclonal antibody treatments are recommended for you, I would advise you to follow that, to take it.
Great. Well, thank you so much for joining us again and sharing your expertise with us, Dr. Salinas. And thank you so much for everyone who tuned in. If you joined us after we began the broadcast, please make sure to go back to the beginning to get all the great information Dr. Salinas provided. And stay tuned to our social media accounts and our website, uih.org, for all the latest COVID-19 information and tips for staying safe as we have them. Lastly, please remember to wear your mask, keep your distance, wash your hands, avoid enclosed spaces whenever possible, and take care of yourself and your loved ones. Thanks for watching.